As Dr. Robert Murphy is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Let's get an update on new hotspots around the globe.
Well, it's spreading. That's why they call it a pandemic. Of course, at first it started in China, then it got to Europe, then the United States, and, we know that story very well. And now the rest of the world is catching up with us. The big hotspots really are Mexico. I was just on a call with them just last week. Brazil, completely, basically out of control. They've decided to do nothing. Russia, Bangladesh, Pakistan, it's spreading everywhere else. South Africa, Nigeria, all these places are picking up. So with the whole world now contributing cases, we're going to hit some records.
So we did see some encouraging news, though, out of New York City in terms of coronavirus deaths.
Yes. Yeah. Coronavirus can be controlled, though. There's a lot of cities are having the same phenomenon, mostly in Western Europe. But New York City, no deaths for the first time in a long time. It's fantastic news.
But as this spreads around the globe to poorer countries, does the rest of the world have to pitch in to kind of help them, or is it not a factor in it coming back to us that way?
Oh, no. It can always come back to us. Remember, fewer than 5% of people in the country and in most of the Western Europe have been infected with this thing. So there's no herd immunity. We can get everything completely under control, and then these hotspots can come back. Think Mexico. Mexico's right next door.
Yeah.
The problem with Mexico is they're part of NAFTA. They're really integrated with the United States. So whether anybody likes it or not, them or us, whatever, it doesn't make any difference. They're integrated with us more than they are than with other parts of Latin America and South America. So they're competing with us for all the supplies and masks and everything, and they're getting beat out. It's tough down there, very tough.
We heard a lot about Pepcid at the beginning of this pandemic, and now there is this story that says, hey, it may have helped 10 patients at a nursing home, 10 patients who had COVID-19. What are your thoughts on that?
So famotidine, the active ingredient of Pepcid, it's been around. This popped up a couple weeks or months ago. But it's an observation at this particular point. Remember, you got a disease that of all the people that are infected, 98.7% survive. So, kind of whatever you do in some cases is going to look like it works. Mm-hmm. So the people are doing the right thing, though. They made the observation. They even saw some decrease in death, decrease in symptoms, and now they're doing a randomized clinical trial, and that's exactly what you have to do.
All right, let's take a look at fewer questions. Are things opening back up because the virus threat is lessening, or are people just sick of staying at home?
I think it's a combination of things. I mean, the metrics are getting better, but I think people have just had it. They're putting up with the risk to go out. I think it can be done safely. It's time to get back to work. If you social distance and wear your mask, that's 85% of the problem right there.
All right.
Oh, yeah.
Next question. In the last 4 or 5 months, if you've been sick, is it worth it to get the antibody test to see if you have immunity? And do you have immunity if you have the antibodies? Are these tests now more accurate? And if all of the above is true, is it also true you don't really need to wear a mask anymore since you couldn't possibly be a carrier?
All right, there's a simple answer and a complicated answer. Yeah. The simple answer is yes, 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 yes. All those things are correct. However, the complicated, you develop the antibody tests are good now. You have immunity. We have no cases in the world where somebody got this infection twice, which means at least for the first year or so, you're protected. You can't get it again. You can't transmit it to anybody again. It's great. Do you have to wear a mask? Actually, technically, no, you don't have to wear a mask because you're not infected. However, the other people on the street don't know that you had it and your antibody test is positive. You're not wearing your Scarlet A for antibody test, your jacket. So you're going to get some strange looks because, in some places, they're not going to let you on a bus or a train or an airplane without wearing a mask. You can argue all day, science, my antibody's positive, I'm not infectious, but, so you're going to have to sort of go with the flow a little bit, but you are not infectious.
All right, last question. Some sport camps are opening
Yeah.
up in smaller groups, of course. Does it make sense for kids to wear masks playing basketball outdoors with just one friend?
Yes. Another easy question.
So wear the
Yeah,
mask.
because I mean, you're going to bump into each other. You know, basketball. It's like, I mean, I would say the one sport that you don't have to wear a mask is singles tennis.
All right.
Or golf, two people. You know, if you're, you know, especially if one has a slice and one has a hook. They different sides of the fairway. But,
Well, I only
you have to
slice, so
match
I
up your
need somebody who
partner
can hook
just
it to go play. Thanks, doctor.
Thanks, Dr. Murphy.
Okay. Have a great weekend.
You
You
too,
too.
Dr. Murphy. If you have a question for Dr. Murphy, head to our Morning News Facebook page and post it there. He'll join us again on Monday.